COPD are at greater risk of contracting lung disease called NTM. Henny caught up with a doctor, an infectious disease physician, to find out more about the condition. Henny?
Well, thank you for having me. NTM stands for non-tuberculous mycobacteria. And I know that's a mouthful, but these are bacteria that are everywhere in our environment. But it can cause a chronic progressive lung infection in certain vulnerable people. And in fact, in 2010, we estimated there were at least 86,000 cases in the US, and that rate is increasing by 8% per year.
Now, how is this related to, say, COPD?
Great question. So people with COPD or asthma, bronchiectasis, or chronic bronchitis are disproportionately affected with this lung disease because they have some underlying structural damage to their airways that makes it difficult to clear the bacteria from their lungs. In fact, people with COPD have a 15-fold higher risk of having NTM lung disease than those people without COPD.
Interesting. Now, who's at risk for getting this disease?
Well, as I said, these bacteria are everywhere, and we're all inhaling them all the time. So there are certain people that are at higher risk, and that includes people with COPD or other chronic lung conditions, people with a compromised immune system, people that are older, so over the age of 65. Interestingly, women are more likely to acquire this disease than men. And important for your viewers, people that live in the coastal parts of the United States are at a much greater risk. In fact, 7 out of 10 cases of NTM lung disease are made up from people that live in coastal parts of the U.S.
Oh, wow. So how would I know if I have this disease? What are some of the symptoms I should look out for?
So symptoms, unfortunately, are nonspecific. People can just have a chronic cough, and that could be productive of sputum or dry. They may feel short of breath. They might have fatigue. They might be struggling with weight loss or poor appetite. And sometimes people can have fevers and night sweats and chills. Other times people can just have recurrent episodes of bronchitis or pneumonia that's not responding to typical therapy.
Okay, let's talk about getting tested. Why is it so important for people to get tested for this, since, you know, the symptoms are kind of not there?
Exactly. So delays in diagnosis are common. So it's important to get tested because you can develop irreversible damage to your lungs. And to get tested, you need to have sputum cultures and a CAT scan of the lungs to be able to diagnose this.
So this is something you should request from your doctor?
Right, and I would encourage your viewers to go to 2 websites. One is aboutntm.com. That website's going to give them a lot more information about NTM lung disease and how to start that conversation with their provider. And the second website is ntminfo.org. And that website really allows people to connect with other people in the community or online that might also be struggling with NTM lung disease.
Thank you so much for sharing this very important information with us. Enjoy your day.
Thank you.
And we appreciate Insmed Incorporated for sponsoring that segment.